Researchers in New York and Montreal are now testing arthritis medication as a possible treatment for COVID-19. The aim is to suppress severe lung inflammation the virus sometimes causes. Joining me with more is lead researcher Dr. Jean-Claude Tardif and philanthropist Sophie Desmarais. Great to talk to both of you this morning. Thank you so much for being here. Dr. Tardif, what made you decide to test a medication often prescribed for gout?
Because, as you said correctly, the problem we have with COVID is the lung complications mostly. And it appears that these complications are not due because of the virus actually replicating in the lung. It's actually the patient's own immune system that is dysregulated and actually attacks the lung. So that if we can reduce this inflammatory storm, if you will, we're quite hopeful that we're going to prevent the complications of COVID-19.
So you're not targeting the virus. You are targeting the immune system. That seems to be I think a lot of people would listen to that and they would be impressed. It seems almost counterintuitive.
It does sound initially counterintuitive. That being said, there's a lot of data now that has been accumulated over the last 2 months since the beginning of the pandemic, initially in China, then in Italy, that shows that you can actually measure this inflammatory storm in blood. There are proteins that are produced, like a substance called IL-6. Those that have the inflammatory storm have a 3 to 10-fold increased risk of being hospitalized, needing mechanical ventilation, and dying. And so if we can prevent this inflammatory storm with colchicine, we could literally transform this disease in sort of a common cold, if you will.
Well, this research started in March. So tell me, where are things now and when could we see results?
So things are going well. Initially, we did start in Quebec. Then we've expanded to Ontario, Alberta, and BC. And as you said, we have received the help of our colleagues in New York, then California, and then several countries in Europe, and we'll be starting fairly soon in South America and South Africa. That being said, we would certainly be pleased to have more patients enlisting in Ontario, and we're glad to be having this discussion this morning. Now, to get to your second question, when could we have early results? Well, there is an interim analysis that is likely to occur before the end of June of this year. So it's actually just about a month away.
Oh, it's moving quite quickly. Sophie, I want to bring you into the conversation because you made a substantial donation to this research. There are, I'm sure, we can't count the number of research initiatives around the world focusing on COVID-19. What was it about this project that made you want to contribute? And talk to me about the work that's being done and the contributors as well.
Well, hi, Ben. First of all, thank you so much for having us again. I want to start by telling you that since we spoke last time, we now have the Gates Foundation and the NIH Institute that is backing our clinical study, which is unbelievable for us. And that today, I think Dr. Tardif and I can conclude that we are definitely the biggest clinical trial today on COVID-19. So we're extremely pleased, and I'm actually so thrilled and proud of being part of this journey. And as Dr. Tardif was saying, now we're coming up to our first data actually in a month starting today, which is also very exciting. And so we want to, for us to have a data, hopefully very, very positive, but of course we don't know because it's double-blinded. We are trying to get more participants, and those participants a lot of them are in Ontario, and a lot in, unfortunately, in areas that are not necessarily financially not positive, but have financial difficulties. And so for one part, what I'd like to do is say two things that are really, really important to me. The first thing is that, as you know, the world has celebrated all the healthcare people, and every single day at 7 o'clock by clapping our hands and telling them that, you know, they are our heroes. And it's true, and we will continue to do so. But I think that what is really crucial and important also is to be able to say and call all participants to clinical trials heroes as well, because they may end up with their help and their volunteer come into the trial to be our heroes and possibly help us find the treatment.
Sophia, unfortunately, we're going to have to leave it there. But thank you both for your time, Dr. Tardif, Sophie Desmarais. Thank you both. It's a tremendous initiative, and the research is vital. And you can find out how to participate in this research by visiting our social media accounts.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.